Understanding blood transfusions, a vital medical procedure. Hello, everyone. In today's video, we're going to explore the meaning and significance of blood transfusions. This is a crucial medical procedure that saves countless lives every year. By the end of this video, you'll have a clear understanding of what a blood transfusion is, why it's done, and how it's carried out. So, let's dive in. A blood transfusion is a medical procedure in which blood is given to a patient through an intravenous IV line. This process is vital in treating various medical conditions. It's important to understand that blood transfusions don't just involve whole blood. Sometimes, patients may receive specific components of blood, such as red blood cells, platelets, or plasma, depending on their needs. Blood transfusions are required for several reasons. They are often necessary for patients who have lost a significant amount of blood due to injury or surgery. They're also crucial for individuals suffering from illnesses that affect blood production, like anemia or certain cancers. Additionally, blood transfusions can be life-saving for people with chronic diseases or during childbirth complications. There are different types of blood transfusions, and the type a patient receives depends on their specific condition. Red blood cell transfusions are common for treating anemia and blood loss. Platelet transfusions are vital for patients with low platelet counts, which can cause excessive bleeding. Plasma transfusions are used to treat conditions like severe liver disease or clotting disorders. The process of a blood transfusion is meticulous. It starts with blood typing and cross-matching to ensure the donor blood is compatible with the recipient's. During the transfusion, the blood is slowly infused into the patient's bloodstream. Healthcare professionals closely monitor the patient for any adverse reactions during and after the procedure. Safety is paramount in blood transfusions. Donated blood is rigorously tested for diseases. Additionally, matching the blood type of the donor and recipient is crucial to prevent reactions. The most common blood types are A, B, AB, and O, and they must be compatible to avoid complications. We hope this video has given you a comprehensive understanding of blood transfusions. This life-saving procedure is an integral part of modern medicine, helping treat various conditions and save lives. Remember, donating blood can make a huge difference in someone's life. Thank you for watching, and we hope this video has been informative and helpful.